Hello, I'm Dr. K. Purnima from Ankura Hospital, Boduppal. Today I will be talking about postpartum care. So, postpartum care involves the physical and emotional recovery of the mother after delivery. So, we need to know what is postpartum period. Postpartum period is the period immediately after delivery till 4 to 6 weeks. So, this is called the postpartum period. So, in the postpartum period, how we should take care of the mother and what are the problems. First is the self care of the patient. This includes adequate sleep, good nutrition, and taking rest and care of the wound. It can be the cesarean section wound or the episiotomy wound in case of normal deliveries, and also taking care of the bleeding and other issues. Coming to the rest. So, the postpartum mother or the mother who has delivered needs adequate rest. She needs to recover. Her body needs to recover from the trauma of childbirth. So, the patient or the mother should take adequate rest, and she should sleep whenever the baby sleeps, because the mother has to wake up sometimes every 2 hours or even every hourly, so because she has to feed the baby on demand. So she will not have adequate sleep in the night also, so she needs to sleep whenever the baby sleeps. Coming to the nutrition, because she needs good nutrition which is rich in whole grains, vegetables, and a diet which is rich in iron and calcium, and most importantly for healing, a very high protein diet. So the postpartum mother needs good nutritious diet. Then coming to her self care, as far as the bleeding is concerned, so it is better that the mother uses sanitary pads instead of tampons to avoid infections. And also the bowel and bladder health should be taken care of by taking adequate liquids and high fiber diet, and wherever required, if she's having problems of constipation, laxative should be prescribed. This is as far as the self care of the mother is concerned. And coming to the wound care, especially the episiotomy wound or the perineal trauma after normal delivery, so a sitz bath or cold compresses can help her from relieving the pain or soreness, vaginal soreness. Then the next thing which is very very important in the postpartum care is the emotional support that the family or the spouses give the patient, because many women in the postpartum period experience mood swings or depression or crying spells. So all these things are very common, but most of the time they are transient, and usually they don't last more than 2 weeks. But the whole how she recovers, how well she comes out of these psychological problems is only by giving her good emotional support. The family has to be with her, encourage her, and support her. Suppose rarely, in case these mood swings are becoming severe to the extent of going to suicidal tendencies or harming the baby, then definitely that woman is requires immediate and urgent care, medical care, and they may even require medication. The next very important aspect in postpartum care is the lactation and involving the breast care. So lactation is the most important thing, that it has both benefits for the mother and the baby. In the postpartum period, the mother can have problems like breast engorgement, cracked ripples, sore nipples, or even abscess formation. So she needs to be educated from the antenatal period what kind of care she needs to take, what kind of food she has to take. So after delivery also this has to continue. She should be advised or educated about the right position, about the right way to hold the baby, what is correct latching, and how to treat common problems like breast engorgement or nipple cracks. She should also consult, if the problem is severe, any lactation specialist, so that these common and small problems during lactation are avoided and baby can have the benefits of exclusive breastfeeding. The next aspect in postpartum care is when and how many times the mother should have a postpartum checkup, because if everything goes smoothly, the mother will recover well. But sometimes in the postpartum period, some women can develop some wound problems or bleeding issues. So when should she consult her doctor immediately? When the pain in the sutures usually reduce and within 2 weeks, and after 2 weeks usually the pain can be very mild or very little of neuralgias. But if the pain is severe or there is some discharge from her wound or episiotomy wound sutures are also swelling up, then she needs to consult her doctor. Coming to the bleeding issues also, bleeding slowly decreases, and after 10 days or maximum within 2 weeks, the bleeding is no longer red. It can be pinkish and mixed with white discharge, or what we call as lochia. She needs to consult a doctor only when the bleeding is very severe and when she's passing clots. So she needs to consult. And the recommendations are at least 4 postnatal visits in the postpartum period. Next aspect in the postnatal or the postpartum care comes the sex and the pelvic health. So the usually immediately after delivery, either because of the soreness in the vagina or pain at the suture site, or like we have already discussed, her psychological status, the libido is very much decreased. It takes sometimes few months for the woman to recover her libido. So and the intercourse as such is should be avoided for the first 4 weeks, and ideally intercourse should be resumed only after 4 to 6 weeks after she has proper checkup with her doctor, and to make sure that she has all her wounds or her pelvis has recovered well. And in case if the we should also educate and the husband about the healing and the postpartum period. And slowly in the postpartum period, after 4 weeks, the Kegels exercises can be taught or started slowly. And coming to the exercise part, the woman can start exercising after 4 weeks, and she can start with simple things like walking and slowly increasing her exercises. And she can take advice and to improve her pelvic floor muscle strength or the back or her abdominal muscle tone. Slowly the exercises can be started after 4 weeks. The other aspect in the postpartum care is finally would be the vaccines. If she has not received the vaccines in the antenatal period or has missed, she can be advised or she can be vaccinated with vaccines like Tdap, which is immediately can be given after delivery, and then she can be given MMR vaccine if that was missed. She can be even given the booster dose of COVID-19 and influenza vaccines. We also recommend HPV vaccine, that is Gardasil vaccine, which is preventive for carcinoma cervix in the postnatal period for all the women who have not taken the vaccine previously. And in women who are or rather want to know about the contraception also, whether it is temporary or permanent, we have to advise her in the postnatal period about the contraception and the spacing for the next childbirth. Ideally, 2 years gap is recommended so that she can recover fully, and also this baby is breastfed completely. So we have to advise her about the interpregnancy gaps, contraceptions, and for a woman who has completed her childbirth, then we can advise her about the permanent sterilization also. Thank you.